Great. Thanks, Wendy. Yeah, Wendy asked me, and I was delighted to put together some notes really to help guide this process of selecting a quality gap. And you guys are right now gathering a lot of great information about where people see areas that could be ripe for improvement. And I'm assuming that there's going to be, an embarrassment of riches. There's lots of things that could be focused on to make things better. And that's not implying that things are bad, but where there's an opportunity to take things to the next level. And so I thought it'd be useful to try to put forth a potential framework for thinking about okay, there's been a bunch of potential areas identified. How might you go about selecting the gap or gaps that you want to focus on? Next slide, Wendy. So the variables that I wanted to chat about just a little bit today and then open it up to discussion are thinking about a potential topic in terms of its importance, its modifiability, the feasibility of the area, if it's valued, and if it's measurable. And these may or may not align with variables that you're already thinking about in terms of what's going to guide your decision. There's no rules here. And there's also no hard or fast answer to any of these. There's no sort of like test to where you can determine, is something modifiable, is something feasible. But these are just sort of concepts that you should keep in mind. And when we get to the discussion, I'm very curious to hear about any other criteria that you all are using to think about what would make a good focus area and what might be something that you would set aside. Next slide. So importance, this is really what we were just talking about, is that the potential area is anchored in some way in the palliative care domains as described in the NCP guidelines. And there may or may not actually also be a explicit preferred practice that's described in that document. And if that's the case, then okay, check that bar has been met, that criteria has been met. Another thing that you might want to think about as you evaluate a potential gap area is anchoring it in a general concept of quality. And these are the traditional IOM areas that are described when you think about, well, what does quality care look like? So quality care is safe. Quality care is effective, so it does what it's intended to do. It's patient-centered, so what the care that's delivered is aligned with the goals and values and preferences of the patient and the family. It's timely, so care is delivered to a patient, at the right time and in the right place. It's efficient, so it's not wasteful, and you're making the best use possible of resources. And it's equitable, meaning that there's justice there. It's available to everybody who might benefit from it, regardless of their individual characteristics. And in thinking about sort of how your potential focus area would fit into this general concept of quality, it might make it easier for others who are not explicitly focused on palliative care to recognize the value of what you're focusing on. And it also might help you to create alignment between what you feel is something that should deserve some attention, and then a more general view of larger organizational or service goals. Next slide. Modifiable. So this is a good one to think about. Is the gap that you've identified, can it actually be bridged? And are there factors or behaviors that lead to the quality gap that actually can be changed given your practice environment? A simple example of this might link to the story that was shared earlier about, well, we'd like to have it, easier cross-organizational communication, but our EMRs don't talk to each other. So you still might have a goal of improving, the transfer of information, but having a gap that focuses on making your EHRs speak to each other better, that might not be a good one to look at. A lot of this would be addressed in intervention design. So you identify a gap and you think about how might you change that. But it's also worth thinking about, system and process changes that would be required to create the change that you're looking for. So it's not just individual behaviors, it's the environment that people are working in. And here I would just really encourage you to honor your knowledge of the practice environment, the practice culture, organizational priorities. There will be things that may be identified as a quality gap that you just know would not be possible to change given what's going on in your institution right now. So if you're, say, implementing a new EHR, or if there's a fiscal crisis in your organization and nobody's willing to take on something that's going to require a lot of time resources, that might influence the gap that you choose to focus on. Next slide.
Oh, come on. Okay, there.
There we go. Yeah, so the next one is feasible. And this kind of, you need to go back one, Wendy. That's okay. Feasible. And this is, you know, a little bit of a nuanced separation from modifiable. When I think of modifiable, I think in terms of sort of what are the individual behaviors that would need to be changed, or what are the processes that would need to be changed. Feasible is maybe thinking a little bit more in terms of scope. And, you know, anything really is feasible given enough time and money. And I think it's safe to bet that you all will not have unlimited time or unlimited money. You may have experienced that in your work life so far. So think about that. And that's not to say that you need to have a small goal or a very narrow gap that you want to address. It's just that if you're aiming high, if you're going big, is it possible to employ a phased approach? Can you approach this over a course of years as opposed to something you want to accomplish in a shorter period of time? And also, when you think of feasibility, you might want to think about what would it take to sustain the change that you want to make. So is this something where once you get buy-in and processes have been changed, would it be on autopilot, like you've introduced sort of a set of triggers where all of the oncologists are on board and there's an automatic integration of you know, consultation with the specialty palliative care service for certain types of patients? Or do you know, you know, so would it be like on autopilot, or would it be something that's going to require ongoing support after the initial intervention? So, for example, if you provide a whole bunch of primary palliative care communication skills training, how frequently would that need to be offered on an ongoing basis in order to maintain skills or to offer training to new folks who come within your system? So when you think feasible, think you know, time and money, and then also think scope. And this might be the way that you define the gap that you want to address, as opposed to whether this is an area you want to get into or not. But think about feasibility and think about sustainability. Next slide. The next one that you might want to think about as you're selecting an area to focus on is, what is the alignment like? Is this an area that is valued across multiple entities? And you know, you're informing your choice based on stakeholder interviews and upon the partnerships that you've created for this project. But it's worth thinking about the bigger picture and also what's there right now. So is the area that you're intending to focus on, is that aligned with an organizational goal of, for example, reducing wait times in clinics? And is you know, is some level of training that you're offering going to make it possible to make that happen, or fewer deaths in the hospital, or how are things aligned? And then also, how is what you're focusing on, how is that aligned with or contrary to even the way that individuals are being assessed or rewarded? So if individual providers have RVU goals and you're asking them to take on a whole new area of focus as they're meeting with patients, is that going to reduce their productivity? Or could those productivity markers be changed? So, you know, just sort of think about how your focus area fits in with what's there already. And the way that I've heard Mike Rabo describe this is looking for those areas where there's overlap between need and opportunity. It might be that what you want to focus on is really in the wheelhouse of something else that's already going on within one or both of the organizations here, palliative care and the partner organization. And when you find areas like that, it really creates an enhanced prospect for achieving buy-in and also achieving sustainability. Next slide. And then measurable. So, you know, if you think about this gap, how will you know if you've been successful? How will you know if you've closed the gap? And is it possible now to develop data that quantifies or describes the baseline situation? So do you know the point that you're starting from? And it also would be useful to think about, for this area where you're looking to achieve improvement, is there an existing accepted measure that describes you know, what you should be aiming for, either a benchmark or a way to determine improvement? So for example, in the Quality Oncology Practice Initiative, some people say QAPI, I say QOPI, I say COPI. There's a measure that they use. It looks at the proportion of patients where there's been an introduction of discussion of palliative care or hospice within the last 60 days of life. And so if something like that is in place, and it might be meaningful to say an oncology service that you're looking to work with, that is sort of one more checkbox in the positive column of why you might pick a particular area to focus on. Is it measurable? Will you be able to document and describe progress?